Hello, Over the Hill Health Watchers. Welcome to another fantastic and important episode today on the coronavirus. And having a medical background, I'm going to do my best to talk to you about the coronavirus in plain English. The problem with a newscast is it gets you a little pumped up and you're absolutely terrified by the time you finish watching the newscast. In reality, at this point in time, the flu virus is killing more people than the coronavirus. However, that does not mean you don't need to be concerned, or I should say aware. You need to be aware of what's going on and how these things work. If you recall back a few years ago, there was an outbreak of SARS, which is another strand of the coronavirus. There's many strands of the coronavirus. And what the concern is now is that a lot of people are spreading the virus and that you are spreading it before you have symptoms. So in other words, you're spreading the virus before you know that you are sick. And that creates a headache for warning other people before it's too late. Now, the coronavirus in and of itself has already killed a number of people. But the people that it has killed is usually those with weakened immune systems. That is 90% the case most of the time. So in this situation, it's no different than the flu bug. And you need to understand how to combat a virus. First off, where did it come from? Well, from best they can tell at the World Health Organization, the coronavirus came from the transmit from an animal. In other words, there's a change in the protein. I know that doesn't mean anything to you, but what I mean is it went from an animal to human, and then that's what happened. They think it came from snakes. They're not sure. They're working on running it down. So the virus jumps from animal to human, and then it gets transmitted that way. That's just one way a virus can transmit. So, then they're running down trying to quarantine the problem. And you'll see people wearing masks, and that's because it can be a droplet airborne disease. Like if somebody sneezes in your face, just like the flu, you can get sick from it. So it is no different. You don't treat it any different than you would, say, a bad outbreak of the flu. Sometimes we've shut schools down. In my local area, we shut a school down close by because the flu virus was so bad. There is not an injectable cure for the virus, meaning you can't go get a shot and not get the virus, the coronavirus, at this time. There could be in the future, but there's not at this time, so therefore an outbreak then can breed a lot of panic. Now, this leads into the common question, how can I avoid getting the coronavirus? And the basics are still true, and I'm going to go over some surprising things you may not understand on how to better equip yourself in order not to get a bug like this. The best defense against a virus, or any virus, is a strong immune system. Your body recognizes that there's something foreign in there and will fight it off. But when you have a weakened immune system, that is when you become more susceptible to the coronavirus, the flu virus, and the list goes on. So you need to really watch taking care of your health. And I'm going to give you a few tips that people generally don't talk about. But you're welcome to Google and check my facts. I don't mind that a bit. I'm happy for the internet age. One of the biggest factors that can reduce your immune function, one of the biggest things that have the biggest impact on your immune function is stress, and that is not a joke. When you are overstressed, when you're working hard, or you're stressed about something that's coming up in your life, your immune system takes a big hit. So I would say during this season, you need to find a way to alleviate stress in a healthy way. That does not mean you sit down and eat a bag of chocolate, because what that does is then not only increases your stress because you really don't want to eat that much chocolate, but then the sugar itself suppresses the immune system, so then you have a double whammy. Stress is a big factor in sickness, much bigger than people realize. So find ways to eliminate stress. Another group of people that are really susceptible are those who are going through grief, because grief is a form of stress. And you may have just lost a loved one, or you may have gone through a divorce. A lot of things can lead up to that, and people are very susceptible of getting sick when they are going through grief. And another area that a lot of people don't think about, but it hits our elderly population hard, and that is loneliness. Loneliness is, again, another form that causes stress and then causes disease and sickness. If we could knock out stress, grief, and loneliness, our society would be so much healthier, not even considering what you're eating, okay? Now, the next ones are common to all of us as far as avoiding viruses, and that's eating a healthy diet. Don't eat too much sugar. Eat a plant-based diet as much as possible. That's just about common sense in today's world. The next one is alcohol. Alcohol suppresses the immune system. Back off of the alcohol. Better yet, quit it altogether. It does suppress the immune system. So if you can avoid that during especially the cold and flu seasons, you're going to be a lot better off by limiting or eliminating or using very moderately. The best is to eliminate those things, but if you do, be very careful so it doesn't weaken your body and you get a virus that you really don't want. Of course, young children are a high risk, as well as elderly people. Their immune systems are more compromised. For a young child, the immune system's not fully developed. For an elderly person, it's just not quite as strong. The vitality of life is less. So those two groups are always a target and a concern for the World Health Organization and for hospitals and everybody around. So those are some common things to think about to not getting the coronavirus. It is no different than any other virus, but except the fact that we don't have a shot for it, and the symptoms are tough. And if anybody's ever had the type flu virus, which I've had more than once, I mean, it makes you really miserable, and it is really dangerous if it starts to spike your fever. So that's just some common tips, some things for you to think about on how to protect yourself. You know, going and eating a bottle of, 5 vitamin C's and getting 20,000 IUs of vitamin C is not necessarily going to stop you from getting a virus. You're much better approaching it at a holistic level. Now, I'll link to a video below that's a little bit crazy about my cold showers, and I haven't been sick in over a year and 3 months, and you might enjoy that video. So there's a lot of things you can do to boost your immune system, including exercising, fresh air, sunshine, the basic 8 laws of health. So that is your best chance at warding off this coronavirus. If you haven't subscribed to the channel, go ahead, do so, ring that bell. This channel is just getting started. A lot of great content on the way. And until then, we will see you in the next episode.